Hi everyone, Sharon Wong here, and so today we're going to be talking about the commonest cause of hair loss, which is common balding. Common balding is actually known as androgenetic alopecia, and what's even more confusing is that the terminology is different for men and women. So in men it's called male pattern balding, and in women it's called female pattern hair loss. As the name suggests, common balding is common. So 50% of men will have some evidence of male pattern balding by the age of 50, and 50% of women will have evidence of female pattern hair loss by the age of 60. The pattern of hair thinning differs between men and women. So men will typically have an M-shaped hairline with the temporal areas receding, with or without some thinning on the crown. The area and the pattern of thinning in women is a lot wider and more diffuse, so it would be on the crown, but it can spread down towards the sides as well. And typically in women, the hairline is completely normal. So common balding is due to both genetic factors and hormonal factors, and the hereditary pattern is not 100% predictable, and it can miss generations, and also it can come from either side of the family. The main hormonal factor which is involved in common balding is dihydrotestosterone, or DHT for short. We all have free-floating testosterone in our bloodstream, but there is an enzyme in our body called 5-alpha reductase that converts testosterone into DHT. And it's DHT, which is the active form of testosterone, that causes the miniaturization of the hair follicles in those who are genetically susceptible. Now in women, there are some medical conditions where women will produce slightly more androgens or male hormones that would mean that they can present with this pattern of hair thinning at an earlier age. And this is specifically in relation to conditions like polycystic ovarian syndrome. There are actually lots of treatments which are available to prevent progression of further thinning, and in a significant proportion of people to actually improve hair growth and density. The two licensed products for common balding are topical minoxidil, which comes in different strengths, and specifically licensed for men, a tablet which is called finasteride, and that blocks the conversion of testosterone to DHT. There are also a lot of off-license treatments, either topical treatments or tablets, which can also help with common balding. So do make an appointment to see your dermatologist to talk through those. And of course there are surgical options in the form of hair transplantation, which is particularly useful for the hairline in men and also to fill in the density over the crown in both sexes. But just make sure you do your homework and see a reputable hair transplant surgeon.